Good afternoon, everybody. This is Eddie Taylor with the Northern Santa Barbara County United Way, and this is United Voices Community Conversations. We're here with Sue Anderson is back with us. I know you appreciated what we talked about with Reach and the vision of Reach for the future. And we're also here joined by Jacob Martin, our producer. And today, Sue, I want to switch gears a bit. We want to talk about something I know is really close and dear to both of us: literacy and health, and the ties to how health is related to literacy. But let's start by talking about a really cool program that we launched together called Literacy 2.0. The fact that we're currently enrolling newborn babies at the hospital. By the way, Sue, how's it working for you guys at the hospital? What can you
Oh,
share
it's
with us?
amazing. The team up on OB and all, they love this program. I really feel like it's been amazing to see how many of the parents sign their children up for this program. But, we've talked about it. It's an amazing thing that Dolly Parton started
Yeah,
many, many years ago. And to have her name behind it and all the millions of people she has impacted by
yeah,
this program. I mean, the fact that a child can get a book every month of their life for the first five
yeah,
years,
yeah,
and the books are all picked out. They're in English and Spanish,
yeah.
so they're age appropriate. And I just think it's amazing. A lot of our families that deliver at our hospital don't have the money to be
hmm
buying
hmm
books for their children, especially new books and all. So it's really a thrill for them to be able to get this.
I tell you, this is our, well, let's see, I've been here, this is my 20th year, so this is our 16th year with the Imagination Library Partnership with Dolly's Foundation. And the growth now, I mean, it's exponential since we started this partnership with you guys. But it's interesting because the bilingual aspect of our library, it's California specific. There's no other state that does this. So we've got this agreement with the state of California where when the foundation came in that partnership, they had to agree that they would provide a bilingual library. So I'm tracking it, Sue. I'm looking at the register, every single one that comes in right now, because what struck me very quickly was most of the families, whether they're English speaking or Spanish speaking, most of the families are selecting the bilingual library,
Oh, interesting.
right?
Yeah, very
So,
interesting.
and the other part of this program that I'm so grateful that the partnership is here because we realized really early that putting books in the home, it's just smart. In the early years, I got some pushback. Why are we providing books to homes when we have all these libraries? Okay, well, I knew how to argue that comment, but what struck me was that even though we're providing books, we're not interacting with the parents. There has to be a parent engagement component. And that's what you've helped us do. So that parent powered program is the thing that kind of sets it apart and helps to place it at a higher impact level because now we've got a relationship with the parents. We're sending them really highly curated impact messages every week with tips on how to raise children. So they're getting a book, they're reading the book to their children, they're getting tips on how to read and things to do even within reading the book. And then, of course, the last part of it, the BFF, what we call the Bright Futures Fund. We now get to start working with those families to open savings account, custodial savings accounts for their child. The United Way funds those, and that's the part of the fundraising that we're doing. That's our philanthropic effort right now, is underwriting the cost of that program for the next 10 years.
Yeah, which is truly amazing. I mean, to teach kids financial health in a way,
Yes, yeah,
um, is just really will impact them for the rest of their lives. We deliver about 3,300 babies every year,
yeah.
so we're the busiest OB all up and down the coast. So it's really great to have this partnership because every year we'll be able to impact thousands.
3,000 is our goal
Hmm.
every year.
Right.
So we have a couple hundred others that are born in Lompoc Hospital, and of course they're partnered with us as well. And so we're looking at 3,000 families. At the end of 5 years, the business model kind of peaks out. 15,000 families that we'll be impacting through this partnership every single year going forward from year 5.
Yeah, that is truly amazing and having an impact on our community. You know, I worry sometimes that parents are worried about signing up and giving out their information or whatever, but
True.
so far it's been working
It's
pretty well. And the more the
80%.
word gets out, I think, to more and more of the communities, the better.
Well, I think, honestly, I mean, we're the United Way. Lots of people know the United Way. Most people don't know what we do, but they know the United Way. You're the hospital. Everybody knows the hospital, and everybody trusts the hospital. You know, it's a brings a level of trust to the partnership that we really needed. So when the families are there at your facility, there's already a level of trust that's been built. It just opened up for us to say, okay, now let's increase that level of trust with United Way so that we can create the relationships that you guys can't, right?
Hmm.
We can carry on with relationships for years to come. Yeah, I'm a little selfish, so I really am. I'm not shy about sharing this with everybody. You know, we're looking at a business model that allows us to look 20 years in advance and say, this is the future of philanthropy. You know,
Right.
if we're helping families now, they will help other families later. And so that's why we want to engage the entire community. So eh, let's talk a little bit deeper. Relating health to literacy. Now, I've always done it this way because in the United Way, we focus on education, financial stability, and health. And often people ask, well, what's the most important? Well, in my mind, it was always education because without a good education, your health can be impacted, especially if you're not literate. And if you have a good education, you can earn more money. And then I realized one day I was talking to somebody, I said, yeah, but if you lose your job, you're not financially stable. It doesn't matter how much education you have. And if you lose your job, you're probably going to impact your health. But if you lose your health, it doesn't matter how much education or money you have, it's your health that matters. So, where do you guys look at how literacy relates to your business model?
Oh, I can tell you every single day, you know, if you can't communicate with a patient, uh, it becomes very, very difficult to be able to give them the care that they need and deserve because they're unable to necessarily communicate or they don't, in some cases, don't understand what's happening. Like there's been times where someone will come in a trauma case, you know, they had a bad car accident or something, and the team is trying to communicate with them or their families, and it just becomes very, very difficult. And I look at reading and literacy as a whole part of that. I mean, Dolly Parton, I think, when we had our event, you know, basically said that her father was
Yeah,
illiterate,
illiterate. Yeah,
and that's what caused her to start this because she knew how much better his life would have been if he could have read and been able to communicate with people through reading.
yeah,
So it's tough if you think about it that you never are able to read something, so you uh, don't really understand when you're going into the hospital. You don't understand much about it because you've never read anything
that's
on
right.
it.
Yeah,
You know.
it's just understanding. I think even the basics related to health for me, understanding my prescriptions. You know, I've gotten a little older. You
Hmm.
probably noticed over the last
Oh,
20
we
years.
all have, yeah.
So it's some of the stuff that I have to read for my prescription and my own health care. Now my doc is Tom Dawes,
Uh-huh.
right? Tom's great. He talks to me. I get an understanding of what it is he's doing with me and why. But I still have to read about it. And then I get to, because I can now, spend the time to research a little bit on my own because we have all these great tools related to health. I can go on the internet. I can use ChatGPT and do some research. How does it work when you've got a family who, and many of our families are in this situation where they're not highly literate? How do you help those families understand what you're doing in health to improve their literacy? What are we doing now?
Well, along those lines, you know, one of the things that we've had to do is really add multiple levels of interpretation services because it used to be that families would come in and if the parents weren't able to necessarily communicate. Like we have a very large Mixteco
Mixteco, yes.
population here, and a lot of times it would be the children communicating with the parent
Right.
and the physician. Well, you don't always know that it's being interpreted appropriately or
Yeah.
that they're really getting the message. So we have round the clock Mixteco interpreters at the hospital that help with that. We have round the clock Spanish speaking interpreters. So that's all a part of it, of helping with communication throughout the hospital.
It's been it's probably the same for your team. It's been wonderful for us here to get more involved with the Mixteco population over the last couple of years. It started a couple of years ago. We did a USDA outreach program to the farm workers, and I got to meet, not just meet, but get to know a
Hmm.
lot of Mixteco families, and loving families, caring families, really want the best for their kids growing up, and to witness some of the things that we're able to do now. And I was so grateful when we got to the hospital with this partnership that you had the ability to provide us with the interpreters
Hmm.
that our staff needs, because it's difficult to bring in. And I think you'd be happy to know we're actually interviewing a trilingual person right now
Nice.
because we're in partnership with the hospital, and that's going to open doors for that person, that individual's future, right? Um,
For sure. And the trust, I think if they have someone that's speaking their own language and all, the trust of that, they develop a bond and a trust, and then they're willing to trust that this is a good program for their child,
yeah. So it's been a great start. I mean, we've only been at this since the beginning of the year,
right?
so the start has been phenomenal. I can tell you that 80% of the families coming to your hospital um, are joining the program. So
Which
80%
is
are
truly
going
amazing.
into the Imagination Library. Of that, another 80% of that number are doing the parent engagement. And we got a really slow start with the BFF, with the Bright Futures Fund, because it was kind of hard to explain, right? So people were just kind of, yeah, I don't know.
Yeah.
So we started off real slow. I think you may have seen the initial report.
Hmm.
The percentage was like less than 3%. Well, that's now at, are you ready? 100% of the families that are taking the books are also expressing interest in receiving the information on the financial literacy program.
Oh, that's
We
great.
figured out how to present it.
Okay.
Yeah,
Very good.
yeah, that excites me. Of all the things that we're doing with this partnership, that excites me the most. And I'll leave you with this thought, Sue, because this group of kids that are being born now, they're not going to graduate high school for 18 years, right?
Hmm.
So I probably won't be in this position. Might not even be on this planet, but whatever it takes, I'm going to come back, and I want to have a conversation with those kids 18 years from now. You probably think this is your college education fund, but it doesn't have to be. It's your money. You do with it as you please. But I want to be able to show them whatever they saved will become at the age of 65 if they just invest properly,
Yeah, such a good message.
right? The other thing we're going to do, newsflash, we found out that Cal Kids, the state's savings program, has a very low participation rate.
Mm.
And they contacted us because they heard about what we're doing with the hospital. Well, you guys are in the hospital. You're actually working with the families, and we can't. Can we represent Cal Kids and make the connection for these parents with that savings account that's there for every child that's born in California? When they're born at the hospital, $50 is deposited into an account. It sits there. Most of them are going unclaimed. When the parents get the birth certificate and log onto the system with their birth certificate number, is what it is, another $50 is deposited into that account. And then they can add to that account until they're 18. And that's a college fund.
Yeah.
So we can simultaneously create a college fund and a retirement fund for these children who are being born today.
God, that's tremendous. That
It's
is
going to be
really,
fun.
yeah, that is amazing. I didn't even realize that the state has a fund like that.
It was really limited. And so it's like, I don't, we didn't have the bandwidth really to expand with that. Um, but the limitations were extended.
Mm.
Now it's every newborn. It's
Very good.
automatic.
Wow.
Public health department records are what they use to open the savings account in the child's name.
That's
So we're gonna
tremendous.
close that gap and close the loop. So our goal is to add that with you guys and say, okay, well, there's one more. Okay, now let's get them enrolled in CalKids, financial stability and financial literacy combined.
Very good.
I'm
Very
excited
good.
about it.
We will be supportive of that.
Thank you, ma'am. So, any final thoughts or anecdotes?
Just to in closing comment, I think is that it's been such a tremendous program. Our hospital really prides itself on doing work out in the community because truly health extends beyond the walls of a hospital. I mean, the healthier our community is, the 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 less they frankly will need us, but that's a good
That's
thing.
okay.
That is a good
There's still
thing.
plenty of work to be
Plenty
done.
of work, right. And so this is a huge part of it, and we're very happy to be a part of the program. And for our team at the hospital, it's just such a fun program for them too. They get excited about it. They see what we're doing, and very, very good support throughout the organization for it.
We love what you guys are doing for us there and how your team is getting involved. I have to throw a party for them someday.
Yeah,
Pizza party,
yeah, that would
birthday
be
party,
fun. Yeah,
some
we'll
kind of
have to do that.
maybe we'll plan on a 1-year celebration.
There you go.
Until
And then
then,
celebrate how many kids that we've
yes,
signed up.
it'll be fun.
Yeah,
By the way, we're going to celebrate our first 1,000 next month.
that's amazing.
It is amazing. Yeah.
Yeah.
Yeah, it's grown quick. So this has been a great conversation with Sue Anderson. This is Eddie Taylor with the United Way, Community Voices, and Sue Anderson from Marion, Arroyo Grande, and French Hospitals. And it's been a pleasure to have you with us. I'm going to ask you to come back, and we're going to take a whole different direction, Sue, and talk about, you ready? The future of healthcare.
I'll be ready.
Okay, everybody, we'll be back.